Hello? Testing, testing. Hello? Can you hear me?
Yes, we hear you.
Can you hear me?
Yes, we can.
Testing, can you hear me?
Yes, we can hear you.
Testing, testing. Okay. I just want to make sure that you can hear me. Can you hear me in the mic or just without the mic? Confirm that for me. Okay. So I can't hear you. Just wanted to let you know that. So if you don't mind, if you need to ask any questions, just raise your hand and you can put your question in the chat, and I'll do my very best to pay attention to it. Um, Normally, what we do is we have a room full of folks, but tonight, I guess with it being a church night, um, we're not going to have a lot of folks if they're attending services tonight. Or if they're just very busy with their personal lives. So we're going to go over the point in time count training for the shelters in transitional housing programs. And I am also going to do a little bit of talking about brick and mortar tonight because some of our folks that stay in shelters frequent service-based locations where they get services. Um, so that's what tonight's training is going to be about. My name is Martika Baker. I'm with Opening Doors. I've been here for a little over 8 years, and I've been in social services for almost 15 years. Um, it's great to be here. And I normally what I would do is do an icebreaker right now for you to introduce yourselves and tell me what organization with. I see you, Robert, online. I see that you're with 90 Works, so it's nice to if I've not met you before, it's nice that you're here with us today. And I don't know if you have any other staff with you tonight, but thank you so much for taking time out of your busy schedule to be here. Now, now I'm going to share my screen. Have you done PIT before, Robert? Have you participated in the count before? So for the most part, what I'm going to highlight tonight is when is the count, who, where, and how do we perform the point in time count? So I need you to save this date, January 23rd through January 27th, 2025. This is an important date range because this is actually the period of the census count when surveyors will go out and actually canvass the community to try to engage with folks who are experiencing homelessness, whether it's unsheltered or sheltered, and you will collect surveys with them. And then you'll also give them some goodies and give them an invitation to a wonderful event to culminate the end of the point in time count week. So what is the point in time count? That's the main thing that we need to understand is it is a census count that is required by HUD for communities. And it is a count of folks who are unhoused and who are in sheltered situations. So either shelter or transitional housing and other such places where they are staying overnight because they don't have a normal place to lay their head. And so it's a single night within the last 10 nights of January. It's just a HUD mandate. I don't understand why they make us do it in the cold, especially living in the state of Florida. But this is when they have decided that all COCs in the nation need to do this count. So why do we do it? So what's its purpose? We're basically collecting information, the demographic information, and also identifying some key factors or characteristics about people, especially like their disabling conditions and or how long they've been homeless, because it helps us to understand their needs and the types of programs to develop. There are three or four major funders that depend on this information, and we'll get a little bit to that later. Um, this data helps us to raise community awareness about what's going on, what are our homeless numbers looking like, but it is a snapshot. It is not the only data source that we look at. We look at data sources from school districts and also the VA and other entities to try to formulate, what is happening within our homeless response system. So why do we count? One, it's because Congress says to HUD, they have told them that we're giving you millions and billions of dollars to fund communities, right? And because we are doing that, we need you to require for these communities in every state to complete a census count and other federal reporting to us so that we know how to formulate a legislative budget to fund homeless assistance programs. So HUD is actually the largest funder of homeless assistance programs, but you also have funding through the VA and the U.S. Health and Human Services that funds programs for homelessness, but the largest body is HUD. And so we do this because it helps us, the end goal is to get that funding for programs and to really understand the types of programs, like the project types, the subpopulations to target to address homelessness with. And so that is the gist of why we're required to do it. So now let's go into who to count. The main thing to take away from this is we are focusing on individuals and families. And it doesn't matter the family composition. So that means that two men who are completely unrelated to each other can present to us and say, we are a family, and that is fine. They can be partners, they can be significant others, they can be a blended family. It's family is loosely defined by HUD. It's just that they're deciding that they want to live together and reside together. It doesn't matter the federally protected class, so sexual orientation, gender identity, marriage status, all that is thrown out the window. All it matters is the living situation that they're in. So if the person or her family is in an emergency shelter, transitional housing program, hotel, motel, domestic violence shelter, or a cold weather shelter, then they're accountable. Or if they're living in a place not meant for human habitation or an overnight stay. So one thing I want to highlight is that hotel motel has to be paid by a charitable organization or with federal, state, or local government dollars to fund that hotel voucher. Therefore, if an individual is self-paying their hotel, then they're not countable. There are other situations that HUD does not allow us to count during this census period. And that's because they're truly targeting those folks that they deem to be unsheltered on the night of PIT. So they exclude those folks that are doubled up, that are in shelters, that are in not respite centers, but in sober living facilities, halfway houses, criminal justice and healthcare facilities. They don't allow us to count those folks. Not to say that these folks are not in a homeless situation, they're just in a different type that HUD does not allow us to count during the census period. So where are we going to be counting? We're going to be counting at those shelter spaces or hotel stay that HUD allows us to count for this census. And we're also going to count at brick and mortar locations. You're going to hear me say brick and mortar a lot. Those are just service-based sites where people go to access quality care and the supportive services that they need to acquire to meet those basic needs pretty much. So when is the count going to be? The count is going to be January 23rd through January 27th. That's when census workers will be hitting the streets or going to brick and mortar sites to collect surveys. However, the official night of PIT is January 22nd. Now, the official night of PIT refers to the question that we are required to ask surveyors: where did you sleep on the night of Wednesday, January 22nd, 2025? Because that's the official night of PIT for our community. How are we going to count? We have 3 methods that we use to count folks. We're either counting through surveys at brick and mortar sites, or we are counting at shelters or transitional housing programs. Whenever you are out at these locations, you're going to be working with a lead who's going to be assigned with you. They're usually going to have on either a purple shirt if you're at a brick and mortar location, or they're going to have on a badge, a purple lanyard badge that lets you know that, hey, this is a site lead. Make sure that whenever you get to your assigned route or brick and mortar location, you want to sign in with your team lead because they need to go over some high level safety plans with you at that facility that you're going to be volunteering at. They just want to make sure that they have a head count and make sure that you have all of the materials that you need to do the count if you're going to be using maybe a paper survey instead of your cell phone or tablet to do the survey. We have another method of how we count. We use the HMIS. So some of our shelters and transitional housing programs use the HMIS for their programs, especially if they're federally or state funded, because it's a mandate of their contracts. So these folks, if you're entering data for these types of projects inside of HMIS, the only thing we're asking for is you make sure that all people who are participating in your transitional housing program, which means they have a housing move-in date, that they're actually not a housing move-in date, I'm so sorry, that they're actually enrolled and they're actually participating and they're staying in a transitional housing unit of yours, then you need to make sure that you have them in their entry exit on the night of January 22nd. It's actually a Wednesday, not a Monday. Wednesday, January 22nd. We're asking that besides having that project enrollment completed, you add the census data service transaction. There's a service transaction that's going to be added to all of the projects that are shelter and transitional housing, just so we know that you have reviewed your HMIS. This is a trigger for us to say, okay, this agency has validated their stayers that are in their program, and they are 100% sure that John stayed overnight in their transitional housing program. If you don't put that person or ensure that that person has that census data service transaction, when it comes time for us to do data cleanup for the point in time count, the housing inventory count, and the LSA, we're going to be calling your organization, and it may be difficult for you to remember what was going on with your client. So just take the time on Monday night or within the couple of days of PIT to make sure that you get this completed. If the client you know have learned has moved out before January 22nd, make sure that you exit them out of the program before that date, especially if they were not staying overnight in your program on January 22nd. For those agencies that are not participating in HMIS, our expectation is you'll either do an online survey through the Hyperion app, or you'll complete a paper survey. You'll have your volunteers or staff do that. I do understand that some of our shelters and transitional housing program may not have the volunteers and staff to do this work. You could definitely connect with Opening Doors to ensure that you try to get some volunteers that have been trained to come out and do surveying. However, if your organization is under HIPAA or FERPA, I completely understand why you could not let an outside volunteer that is not going through the ACA clearinghouse or whatever clearinghouse you're having to use for background checks come and do census work with your participants. So just make sure that you have your staff here doing this training to ensure that you're not breaking any type of compliancy laws or privacy laws. Are you registered to volunteer? If you're not, you need to speak with Ms. Serene. You need to try to get her to send you that email with the job form so that you can complete the volunteer sign up and sign up for your location. And that's likely how you even got here today. It's because you've already done that. The volunteer roles that you can have, most times you're going to be working in pairs or trio. And so you may be the staff member in your pair or trio that is doing the survey. You might be the person that's inviting and waving people over to get surveyed at a table. You may be the person that's completing the paper survey or giving the incentive bag. So you may have various roles and you're going to have to be able to juggle different tasks. So try to arrive at least 30 minutes ahead of time if you're working a brick and mortar shift for the shelter count. If you're going to one of the shelter locations that has, feedings or soup kitchens. So you want to make sure that you're there 30 minutes early to check in and go over the safety presentation and the harm reduction presentation. You want to make sure that you collect your needed supplies from the site lead. Make sure you have your cell phone fully charged. And this shifts that you're signing up for should be about 2 to 4 hours each block. If you're having to leave your block, please make sure that you notify your site lead because we might have to fill in a gap and call another volunteer from another location. So it is important that you try to stay for your full shift, but if you don't, you notify them. And then at the end of your shift, just make sure that you return all your unused materials back to the site lead's table so that we can bring that back to the hub to recycle for other outreach efforts. So now we're going to get ready to survey. There's 3 methods. The 3 methods include the paper survey, the Hyperion online survey, and the HMIS, as we said before. So today we're going to actually practice the Hyperion app. And within the Hyperion app, you're going to see this information is generally what we ask for. You're going to also see some features related to Social Security number, right? Some people get so concerned about seeing that Social Security number. That's, of course, you're going to be concerned, right? Because that's a person's PII. That's going to be their identifying information. And so people aren't very open to sharing that sometimes, and that's okay. So that is the reason why the Social Security number is not a mandatory data field within the survey tool. A client can say, hey, I refuse to give this answer, and you can skip over it. If they say, you know what, I'm not willing to give the full 9, but I'm willing to give a partial, you can record a partial. That's okay. One question that always comes up during these trainings is what if, within this app, you're going to see where we ask you date of birth and the age of the person. Sometimes when people are living in the elements, they might be off a couple of years when it comes to, doing the math of their date of birth and how old they are. And so just record what they state because what we're going to do is cross reference to HMIS. A lot of folks, a portion of folks are usually existing in HMIS and they're from this community. And there are a portion who aren't here, but we're going to do the very best that we can to deduplicate. If you do end up recording a duplicate survey, so you survey James Smith and his partner at Alfred Washburn Center, and then you engage with them during street outreach at another area, it will flag that, hey, this is a possible duplicate. And we will know to check those records and try to figure out, is it truly a duplicate or not? If it's a duplicate, then we discard the duplicate survey after we verify the information. Paper surveys are there to help people feel comfortable, especially our friends who are not very open to their information being entered on a cellular device. So we want to make sure that you have that paper option just in case. And with the paper option, we are going to have some assigned HMIS staff that you turn those paper surveys over to, and they will enter the information into the Hyperion app, because that way it's not recording their information at an encampment. That's most times why people don't want to be surveyed. It's because I'm not comfortable getting my information into this app with me knowing that you're probably recording my location. And so they don't want us to record the survey on a cell phone usually when we're near their camp. So alternatively, let's do the paper survey and then we'll take the paper survey offsite to a HIPAA compliant professional who can get that survey recorded. Within the app, you're going to see a script. There's a sample script for you to use. It's on the paper survey and it's also in that Hyperion online application. And so you'll just follow the script. And it is going to say for the 2025 homeless pit count. So you just follow it and you can do no wrong if you do that. So now if you have time, go ahead and practice this. It should take about 15 minutes for you to test it out. There are some cool bells and whistles I would like to go over if you're with me over the phone or online. You're just going to go to Pit Counter, www.pitcounter.com. That's obviously a web address, so it is not in the App Store or the Google Play Store. You're going to need to go to your web browser, Chrome, Mozilla, Safari, type this in. The code is case sensitive. You want to be very careful with the code that you put in because we do have other communities that use Hyperion as their survey tool, and you do not want your survey in Escarosa to go to Okaloosa Walton or Bay County on accident. So once you get into the app, basically what happens is, well, the application, you should be asked to register as a volunteer. So it should be asking you for your name and your phone number. That just helps for you to be registered so that we know who to call if there's an issue. Location services. Now, if you're in outreach, like as a street outreach time, hitting the street corners and going into the wooded areas for encampments, we do not expect for you to turn on your location services because with what's happening in our state about homeless camping being an issue, we're trying to just protect the privacy of those folks. We're trying to make sure that we don't do anything that's harmful. So we don't expect for the location services to be turned on. If what you can do instead, if you are a part of a street outreach team, is to use the zip code or to use a nearby business to just say, hey, it's near here. But don't put an actual address and you don't have to have your location services on. Now, if you're at a brick and mortar location, like a soup kitchen, a food pantry, Most times that's not going to be near the person's encampment. So you can have your location services on. Um, and please make sure that your location services are not set to always, but are set to while using the app, because we don't want you to be getting tracked if you don't want to, um, outside of the census period. Entering date of birth on Android devices. If you have an Android device, when you're changing the date of birth, always just click on the year, which is on going to be in the left-hand corner. That way, change the year first and then move to the actual month and date. Because if you try to just use that caret that is going to the left or to the right, um, it's going to take you forever to get there. So you want to make sure this survey is quick. So use that year first. So when you're at the brick and mortar locations, anywhere that you're going to always need a cell phone and a portable battery charger. I would also recommend that you have some type of water or water thermos. You're going to probably need clipboards and pens and have a snack for yourself. You're going to also be carrying some care bags. And the care bags, those are going to be prepared by Opening Doors and also the wonderful volunteers that are coming for the care bag stuffing party. I'm going to get to that near the end. And what we're just asking is that um, pay very close attention to what I say regarding the care bags, because there's a lot of instruction for you as a volunteer of how you handle it. So for the care bag, as a volunteer, inside of it is going to be a lot of food items, PPE, toiletries, and more. If you're a provider who wants to ensure that you have things regarding your organization within the care bag for folks to know how to reach out, you want to ensure that that information is here no later than January 16th at about 3:30, because we're going to be setting up the whole multi-purpose room here as a hub for volunteers to come in and stuff the care bags. We're going to be doing about 1,000 to 1,500 care bags this year. We have a lot of the items already ready to go, but it never hurts to have more, because last year we ran out very, very fast. And actually, it was 90 Works that came in to help us stuff more. So we definitely need as many donations as possible to go into these bags. Also within there is going to be a resource sheet, and there's also going to be a real change homelessness you count wristband. It's purple, and it's going to have a white flyer tied around the wristband. So it is important that you as a volunteer open up that care bag and you explain to the individual, hey, this is a wristband in a bus pass. That's what that white piece of paper is that's going to be attached to that wristband. That is actually a paper that is an admit one round trip ride on the ECAP bus along the route that is going to the Homeless Connect event. So for the real change you count wristband, you want to make sure that you inform people of its purpose. You want to also inform them that the wristband is good for them a round trip on the ECAT bus to get to Brownsville Community Center and return to their sleeping area. And so you count is going to be Monday, January 27th at 9 a.m. If you are a provider, we are asked, or you're going to be at the event as a vendor, we're going to need for you to ensure that you have signed up with Miss Elizabeth Kissel at Escambia County, and you're going to need to arrive to the Real Change UCount event no later than 8:30, because we want to make sure that when doors open at 9 o'clock, that folks get the most out of coming and engaging with the service providers that are there for this resource day. So some tips. Most of these tips transfer in whatever situation that you're in. The main thing to remember is you're always going to take your cues from the people that you're surveying. Our folks deal with a lot of trauma because of, the situations in which they are in due to their homeless experience. So we always want to gain their permission even before we sit down, especially at a lot of the brick and mortar locations. There's a lot of places to sit and be comfortable because they're eating, they're having coffee. And so you want to get their permission before you even sit down, and start going into the spiel of why you're talking to them. Because sometimes they're just ready to eat. They don't want to talk. They want to eat and then get their laundry done and move on to the next thing to do their job for the day, right? Um, don't crowd around an individual or hover. Um, just That's the importance of asking that permission. So we're just want to be respectful of their space and their belongings. We always want to be kind and treat people with dignity and respect. Acknowledging people with a smile and greeting them, genuinely is so important. It just breaks things down. I like to ask people about their pronouns. I like to ask people their preferred name just so that I respect them and their autonomy as we're going through the survey. And if the person tells us, hey, I don't want to be surveyed right now, I'm trying to eat my breakfast, I'm trying to go do my laundry, then we say, you know what, we'll come back later, or would you mind I come back later and talk with you after you've, had your meal and, done your laundry. And most times they'll respect that if you even ask that, and they'll agree, they'll come back and find you actually, especially at like one of the brick and mortar locations. And so respect their choice, move on, and just say, I'll come back around and talk to you. Always introduce yourself, use your first name when you're doing the survey. It just helps to break down walls. Uh, at the end of the survey, you're always thanking people for their time. You're giving them the materials for the care bag. You're giving them that care bag because it has all those wonderful resources in it. And you don't want to give folks the bag if they don't want it. It's not to say don't give it, even if they say, I don't want to be surveyed. Please give people the bag, even if they don't want to be surveyed, even if you're just doing outreach, street outreach, and they're not willing to be surveyed or they quit in the middle of the survey. Make sure that you say, okay, well, I'm going to give you this care bag. I want to tell you about something that's in it that's going to help you get to an event that has resources for you. Don't force them to be surveyed, um, because we don't want it to be to where we're pressuring people to be surveyed. Um, you might have to hone your case management skills, your motivational interviewing. Hopefully, you can do a good job, and a person will feel comfortable with doing the survey without any heartache. But if not, go ahead and just give them the care back, because we're gonna do a checks and balances at the Homeless Connect event to make sure that we've at least made a very last attempt to get a survey. So what we're not going to do when we're meeting with someone is we're not going to touch them without permission. We're not going to give any money or non-essential items to them. This is case management 101, right? Or social work 101. You don't want to assume anything about the client. You want to respect their choice. You don't want to bring your purse or wear any expensive jewelry, and you don't want to give any of your personal information. And you also want to be careful that you don't proselytize. We don't want to make it a counseling session or make it a religious session. We have to keep in mind the focus of things is to come in and meet with folks, get them this precious information, collect information from them, and move on to the next person. Other safety tips that we need to be mindful of is always go out in pairs of 2 or 3. You want to keep your eyes on each member that's in your group. Always back your teammates' sit. Wear comfortable and warm clothing, especially on these cold days and nights, because we're going to be counting from sun up to sundown. We want to make sure that you bring water for yourself and make sure that you keep your phone charged. No exit routes at all times. Even if you're at the brick and mortar locations, there are times at the brick and mortar locations where there can be an emergency situation with the client or with the staff. So you just want to be aware of your exit routes and also of making sure that you have everything available to you to take care of an individual or yourself. So trust your own judgment. If you feel uncomfortable, especially if you're going to be in like encampments and things of that nature, or just in large crowds, make sure that you're just keeping a buddy with you. So if you feel uncomfortable, remove yourself from that situation. Be respectful of space. Be respectful of choice. Just remember that this is completely voluntary to participate in the survey. Um, don't force people to participate in the survey. Move on. You can give them the care bag, and we'll try to catch them later at the UCount event. And if you encounter any pets, just remember these are companions. Let's not say anything bad about the dogs. Let's not talk about, the state of things with the dog and the owner. Always take your cues from the owner, because the owner can help break down, any type of upset with the companion animal. And sometimes it just helps if you have dog treats or food for the dog, and always ask the owner, can you give them some items for the dog, some dog treats, or give the dog a dog treat, because it take care of the owner first, and then get to addressing the dog, because that just helps with the whole relationship of trying to get the survey. Um, if you call 911 because of an emergency, make sure that you let your team lead know. If, especially if you're on outreach, or if you're at one of the brick and mortar locations, talk to one of the site leads that are in the purple shirts or the purple lanyards. Inform them of the situation. If you're having to leave your location, you have to tell your site lead, because we need to make sure that we can get a new volunteer plugged in your absence. When it comes to monitoring your health during this census period, when we start off for the week, make sure that you're self screening, do temperature checks, isolate and quarantine if you feel like it's necessary. So, if you can just, everything that we were doing during COVID, it's pretty similar to what you're going to do to monitor for cold and flu symptoms. So, and that's mostly what's going around right now is cold and flu. So just check yourself. We're doing a lot of these trainings virtually, so that's limiting our capacity and size for indoor trainings. And you're going to be using that mobile application mostly instead of the paper forms. But if you have to, try your best to limit, the contact. We ask that you're doing the survey, preferably anyways, so that the forms are handled by yourself and other volunteers, and not the individual that's being surveyed. Pay attention to the Department of Health guidance that may come out. If there's an influx of any types of infections, we just want to be mindful and observe your symptoms for about 2 weeks after the census count. Some other important dates that you might want to know about. If you're planning on doing brick and mortar, you might want to come tomorrow, um, or Tuesday, January 14th. We've had 4 sessions so far. We're having a care bag stuffing party on Friday, January the 17th at 9 a.m. until all of our bags are full, or until we run out of donations. Remember that you can bring materials for your organization to be put into those care bags, um, to Opening Doors, which is at 1020 North New Warrington Road, no later than the 16th, Thursday the 16th, by 3:30 p.m. And the census count period is January 23rd through the 27th. So we're always going to ask people, where did you sleep last night, the night of January 22nd, 2025? And please, 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 if you can, if you are allowed to come to the UCount Homeless Connect Day for real change, please come January 27th, 2025 from 9 a.m. to 1 p.m. We hope to see you there. If you have any questions about the brick and mortar locations or the shelters, please feel free to give us a call. If you need to sign up as a volunteer, please reach out to Ms. Serene. Her email and number are there. If you need any assistance regarding, um, especially when it comes to HMIS, or what to do for non-HMIS for shelters and in transitional housing programs, please don't hesitate to reach out to me. And that's my contact information at the top of my phone number. Uh, okay, so that is the end of our presentation. I'm so glad that you were able to do this last year, Robert. So you have now done everything that you needed to do to make sure that you're ready to be a volunteer. I'm hoping that you're able to complete that hold harmless form for Miss Serene. All right. Well, we look forward to seeing you during the census period. And if you want to come for any of the volunteer opportunities leading up to the point in time count, you are welcome to stop by. Thank you so much for your time this evening. You have a great day.